Alright, so this is my elbow wrist video, and this is going to be portion A. So we're going to start out with active range of motion for elbow flexion. So you're going to put a towel under the humerus, kind of keep that in line there. And so first I'll have to demonstrate the motion, so I'll have you bring your elbow up, put it back down. So next we'll use the goniometer, fulcrum on the lateral epicondyle, stationary arm along the humerus towards the acromion, and move an arm up along the radius of the styloid process. Very good. You went up, and so what we're looking for is a range of motion between 145 and 155. So he's right at about 147, so that's good. And so I'll have you sit up next, and we'll do active range of motion of supination. And so we're going to have the arm elbow flexed. And then I'll have him demonstrate the motion first, so I'll have him just supinate, just like that. And then next, the fulcrum is going to go, if you supinate, along the third metacarpal right there. And then the third right there. And then the stationary arm is going to go straight down, and the movement arm is going to move with the line of the joint right here. So I'll have you supinating him. Yeah. And then you can supinate. And so he's at 90, which is good because what you're looking for is 90 degrees, so that's great. And then next we'll move into passive range of motion of extension. So have your arm flexed. And then we'll just move your elbow into extension. And then what you're looking for is a hard infield because of the olecranon process coming into contact with the olecranon fossa. And then next, we're going to do passive range of motion for supination. So then, grab your hand like you're shaking it, and you're just going to rotate, and that should also have a hard infield because of the radius going over the ulna. So, move into manual muscle tests, and the first one is flexion. So I'll have you at 90 degrees. And first we're going to do, there are 3 ways to do this. So you're going to start with supination, and I'll press down. Here, press up against me. Alright. That's testing the biceps brachii muscle. That's like 5 out of 5 for him. And then we'll do neutral, and the neutral position is going to test the brachioradialis. Again, another 5 out of 5. And then pronation is going to test the brachialis. And that's another 5 out of 5. Good job. And then we're going to do manual muscle testing for supination. So I'm going to have you try to supinate into my hand. So try to rotate your hip. Alright. And so what you're testing for that one is the biceps brachii and the supinator muscle. And so I give that a 5 out of 5. Strong. And so next we're going to move into the valgus stress test. So I'll bring the elbow into about 20 to 30 degrees of flexion. And then you're just going to hold onto this arm and apply a lateral force. Put it down here, and then I'll put it back up. And so you're going to feel the medial joint line as you're applying this valgus force. So we'll just do it. And so positive is going to be there's increased pain relaxity when compared bilaterally. So you always want to check everything, both sides, to make sure you're getting a good test. And then that's going to be implication for a sprain of the UCL, especially for the anterior bundle. And then next, I'll have you lay down, and this one is going to be the posterolateral instability test. So you're going to bring the arm up to 90 this way, 90 shoulder, 90 flexion, like this. Have them supinated this way, and then you're going to find axial load and valgus force as you extend their arm, like this. And so when you extend it, if the elbow subluxes, and then when you bring it back into flexion, it relocates, and that's going to be a positive test. And then the implication for that is going to be chronic elbow instability. So you can sit up again. And then the next test is Cosen's test, Cosen's. And so this one, elbow back in 90, pronated, fist. We're just going to resist his fist here. So try to bring it up. All right. Positive it is if there's sudden severe pain over the lateral epicondyle over here. And that's going to be an implication for lateral epicondylitis. And then for golfers, for the golfer's elbow test, I'll have you supinated. We're going to extend your hand this way. And so your elbow's back into 90, and then you're going to extend the elbow and keep the wrist and fingers in extension. And so when there's pain over that medial epicondyle where those wrist flexors and pronators attach at, then that's going to be an implication for medial epicondylitis. And then next, we just have the elbow flexion test. So you can turn that way a little bit. And then we'll just have you flex your arms up this way in neutral position. And then I'll have him extend his hand and fingers and then depress your shoulders. And then if there's pain radiating down the medial arm into the fourth and fifth digits, and that's going to be positive for this test. And you can put your arms down. And that's going to be implication for cubital tunnel syndrome, or otherwise known as ulnar nerve compression. And that's the end.